All right. Hi, everybody, and thank you for joining us today for our webinar on the role operational agility will play in reopening restaurants safely. A couple housekeeping items. We will be recording the webinar and we'll follow up with the recording after the event. We also hope to have time at the end for Q&A, so please feel free to submit your questions in the questions panel of GoToWebinar. With that, I'd like to introduce our moderator for today, Zenput founder and CEO, Wladek Richter.
Thanks, Cassie. Good morning, everyone. Well, good morning, good afternoon, and maybe in some cases, based on what I'm seeing, maybe even good evening in some of those. Thanks for joining us this morning, or again, wherever you may be located. I'm gonna walk through this a little bit, and there we go. Give me a sec here. I want to introduce, to start with, as Cassie said, I am one of the two founders and the CEO of Zenput, but more importantly, we have with us today Dr. Hal Kane, who's the founder and CEO of Public Health Innovations. Previously, I promised him I wouldn't go into a deep intro. So previously, Dr. Kane was working with Chick-fil-A, running their food safety initiatives. He has also spent time as a researcher at the CDC, as well as the U.S. Army, the United States Army, Air Force, Army Force Health. And so Dr. Kane is the recipient of the 2018 NSF International Food Safety Leadership and Innovation Award. And outside of the fact that that he's a phenomenal person, I'm also personally just happy to call him a friend. So it's always enjoyable to spend some time with him. Hal, thanks again for joining us, and feel free to say hello to the community.
Thank you, Vlad, and thank you for that great honor. I consider myself honored to be your friend. I love the fact that folks like you, and I will say younger than folks like us, who are starting these companies to satisfy the issues related to food safety and public health through better technologies and systems to ensure these things is really exciting to me. So I'm honored to be here and help with this need.
Wonderful, wonderful. We're glad to have you here. Well, let me before we get going into our actual kind of discussion, I want to give you guys a little bit of background on Zenput for those of you that aren't familiar with us. So Zenput operates today as a solution for food safety compliance, brand standards compliance, marketing compliance, and really we help multi-unit operators turn strategy into action faster and equip teams to deliver on it. Right. Today we operate with over 500 customers across 50,000 plus locations in over 40 countries. Our offering and the way that our kind of platform works is it's a blend between what you do at the store from a store performance side, field management, and ultimately orchestrating operations, right? So this works everything from the scope of the day-to-day task management that stores need to get done, the audits and the corrective actions that are being driven by the field, and then ultimately that kind of compliance tracking that comes in from an operational standpoint, right? We pull all this together into a single platform, a single SaaS platform that gets delivered across all of your locations and can leverage a little bit deeper into a more kind of concept of a connected store where we bring in potentially, potentially hardware devices and IoT devices that kind of help drive even deeper compliance within that. So one of the things that we've seen over the course of the last 90 days is kind of how different food service or food retail operators are responding to the COVID-19 outbreak, right? And that generally means that, you know, what have we actually seen, and what have you guys seen yourselves, is that we're rolling out new cleaning and sanitation procedures on a weekly basis, in some cases even daily, as things are changing. Obviously, you guys have seen the importance of screening employees for symptoms and making sure that you're making sure that any individual employee that may not feel well for the day is being sent home. Enforcing compliance with remote field teams. This is very challenging. Right before, you had a lot of folks coming into the restaurant or the store on a regular basis. And now you're looking back and saying, well, I can't let those folks come in. So seeing a lot more compliance with being driven remotely. And then naturally converting operations to takeout delivery, right? I'm sure some of you saw the news yesterday as it applies to Starbucks announcing that they're going to be closing 400 of their stores and start to move heavier into kiosks and kind of pickup areas along the way. So it's been a fascinating 90 days, a lot of emotions up and down, but then ultimately, as the businesses have changed, you know, things are moving forward in a slightly different capacity, which is what we're going to discuss here with Hal. So as a starting point, I think we'd love to get sort of a webinar poll across the board. What percentage of your restaurants are opening or in process of opening for dine-in service? Okay. We'll give everyone a second to kind of fill out the poll as a good starting point here. Wonderful, I think we got that. So this is a pretty interesting mix. So we've got almost a quarter of you have said that none of your restaurants are opening for dine-in service, right? Whereas on the other side, about a third are over 3/4 to maybe the full amount, right? So we've got a full gamut here in terms of what's opened across the board. And I think this has been the challenge, because for those of us that operate across state lines, right? I'm sure some of these questions, if you're operating in a state that's already started to open back up, you know, the state of Georgia, the state of Texas, the state of Utah, and all of your locations are within that environment, that's one kind of driver. But if you're opening across, if you operate stores anywhere from, you know, the city of San Francisco, where things aren't necessarily opened up, to places like, or the city of Manhattan, to places like Georgia, you're operating different standards with different people, which makes it a little bit challenging. So I think as a starting point, you know, Hal, we'll talk about this kind of as a first question, but as restaurants start to reopen, what initiatives are they prioritizing to keep customers and employees safe, and which areas do you know, do they feel kind of best and least equipped based on the conversations you've had?
So I think we all know that in this new normal of business continuity, we really all kind of track what the true risks are of the virus. It's a respiratory virus, so it's not a foodborne disease virus, but now it's entered into our workplace and our businesses and can touch our customers and employees. We've all got a new sense that we've got to know what to do to prevent that from happening. For example, exposing an employee while they're at work, or a customer while they're come to visit the restaurant, or even to pick up food. So all of us have probably been just overwhelmed with trying to keep up with the guidances and trying to implement those guidances in the current state of the business. But now we're thinking and talking, and as we see on the poll, we're moving toward the greater part of a business, and many food service businesses are the dining room. You know, the more they can come in and sit and eat, the more they can order, the more the sales can go up. They can bring back the sales they need. But now we're in an environment where, is it safe to be in that dining area? And so two things that are really going to be critical is now adopting the guidance that we know to date, that the CDC is recommending, and FDA helps us with application of making sure employees can work safe. You know, that I think we're all kind of attuned to masks are critical right now for what we know about prevention of the spread of the virus from person to person. Same thing with customers, whereas when customers come in a dining room, they can't eat with a mask on, so they're going to be more reluctant to take their mask off if they don't feel like that environment, the air, is safe for them, even if they see an employee with the mask on, because they know other customers are not wearing masks. So you got that sense of, am I safe in this environment? So the critical part for them is going to be the employee safety first. Is the employee safe to be around? The mask helps. I still think that the restaurants are going to want to ensure that they are screening employees for wellness, to make sure the employees don't work sick, and they're tracking them to ensure they don't show back up to work the next day after they've been excluded, because they might have signs and symptoms of this respiratory virus. And I think that's going to be key to establishing a safe environment, as the employees are actually not sick. And then also the presence, or like you said, the SOPs are being executed to ensure surfaces are being cleaned and disinfected properly. So the challenges in that is, and really the restaurant industry should have been doing this all along, to reduce norovirus outbreaks. That's not a respiratory virus, that's a foodborne pathogen, but it's spread kind of in a similar way from surface to surface, not through aerosol, but from surface to surface, touching surfaces, touching food. Employees get sick from other employees, customers get sick through outbreaks. We should always have already been doing a wellness check for employees, just for signs and symptoms of vomiting, diarrhea, things like that, to exclude them from working with food that could cause an outbreak. So now we just need to pivot to doing that, and respiratory virus symptoms and signs like temperature and things that you see in the guidance documents. That needs to be a critical foundation of operations right now, especially when you're just going to start doing dining room service. And then the other part is just making sure that How do you know we're cleaning and sanitizing the proper surfaces? You can't use a disinfectant on food contact surfaces. So if that statement causes you to question, are we doing it right? You might not be doing it right, because you need to have two separate processes of cleaning and sanitizing for food safety, and then cleaning and disinfecting for COVID-19. And a lot of folks, if they just go out there and try to wing it, let's go just use what we're doing now. We're using a rag and a bucket, and we store the rag in some sanitizer. Well, that doesn't kill the virus, the bucket of water. And so why would you want to use that to basically transmit virus all over the rest of the restaurant? You maybe just need a separate way to actually clean and sanitize versus cleaning and disinfection. So that's a challenge. And then ultimately, like what we're talking about today, how do you know they're doing it right? If you don't have some process of making sure they've got the most current SOP that can change on a weekly basis based on some guidance from CDC, or you're actually making sure that they're doing the processes through not checklists, but actual observable compliance through these type of technologies, then you might not be doing what you need to ensure the customer is safe. And if the customer doesn't experience safe, they're not going to come back.
Yeah, that's a good point, right? A lot of us in the last 90 days have had to become experts in areas that we're obviously relatively we're not familiar with, and things change on a regular basis. When you think about sort of designing some of these employee wellness checks and sanitization procedures, where do you suggest, to the audience, where does that guidance come from, right? Like, there's the designing portion of it, and then afterwards, obviously, the execution piece of it. But how do you, if you're looking at an operator that's got 50 or 100 locations out in the market today, how would you encourage them to kind of put these things together?
So the foundation for employee wellness checks was initiated by the FDA through a health policy, which already has been established and already well tuned to kind of monitor employees for vomiting, other illnesses that might suggest they have norovirus or other infections. They shouldn't be working on food. The critical part of that to work properly is to know when to exclude them. And the most critical part of that is when can they come back to work. So, if they've been vomiting, have diarrhea, you don't want them coming back to work until they have no symptoms. If they weren't diagnosed, you want to make sure you track a process in that. And formerly, you should have been using a sick log that would help you track that employee when they were excluded and what day can they be put back on the schedule, right? So you might have a manager 2 days later, I need somebody to work. That's what's caused a lot of outbreaks, is people don't know this person was excluded because of symptoms. They let them return to work, put them back on the schedule, and now they're actually back in the restaurant spreading the disease. It's the same thing for COVID-19 and pandemic coronavirus, that you now have guidance that you need to screen them for certain signs and symptoms. You need to exclude them, and then based on what they were either tested positive or excluded from symptoms, there's a criteria according to the CDC guidance about when they can be allowed to return to work. But if you're not tracking that through a process like a sick log, then how do you know they're not going to come back to work too soon? And then you're going to be liable for letting them work while they were sick. And so that's going to be critical to have a process that updates to the current guidance documents for both of those things. Now, the FDA hasn't changed that much as it relates to foodborne illnesses, but the COVID-19 does change. As a matter of fact, 2 weeks ago, it changed from when could you allow an employee to come back based on no symptoms. It changed from 7 days to 10 days based on what we're learning about the virus transmission. So that's going to be critical, and you have a critical part of making sure you can track excluded employees and not let them return to work. Why would that be really important? Well, in the city of Los Angeles, they're actually talking about posting on the website, not just health inspection scores, but when a person tests positive that worked in a restaurant. Now we're getting into an area where, hey, you have an employee working at the restaurant with hepatitis A, everybody needs to get a hepatitis A vaccination if they ate at this restaurant. Well, now we're moving into monitoring respiratory disease infection in these restaurants. So that's the really new normal, but you can do that pretty simply by making sure you have a process to exclude the employees with the right signs and symptoms checks, doing the wellness checks, putting them on sick leave, and then tracking that for the return to work policy. And the same thing, Vlad, for the sanitation and disinfection processes. I know we all try to group in sanitation to mean killing stuff on surfaces, but we really do need to make sure that we can designate the proper procedure at the right time for the proper need. So viral infections can be handled by disinfection, both norovirus and the COVID-19 virus can be killed by the same type of disinfectants that the EPA has said that will kill these viruses. But you really want to segregate that process away from just doing general sanitation, which you might be doing on a casual basis when you think you need it. Well, now you have to actually target sanitation and disinfection to actually mitigate these viruses.
Yep. No, that's a fair point. That's a fair point. And I think maybe Coinciding with this, be curious from the audience, I think, relative to all the compliance things that we're sort of rolling out. How confident are you that your restaurants are in compliance with some of the new or updated procedures that you're rolling out? I think this would be a good sort of kind of insight to understand in terms of confidence people are sharing, seen in their own environments.
Hey, Vlad, I think a key part of this question too is, do you have documentation or evidence to help support your confidence? I mean, we can all have a feeling that, hey, I don't think I have any outbreaks because I haven't had a foodborne disease outbreak, but you might actually be causing a lot of people to get sick. You just don't know it, and it's not an outbreak.
Yep. There we go. So we've got interesting mix here, right? We've got about almost a fifth of folks that saying they're not confident at all. 44% was the bulk are saying they've got some sort of confidence, right? And then about 38% in total have confident or very confident. Yeah, I mean, look, this is inherently this is relatively interesting, right? Because I think that also becomes a reflection of sort of consumer confidence, right? If there is confidence that is lacking amongst operators about their ability to execute, right? If you're seeing nearly 20% are saying, hey, I don't have very much confidence at all that my restaurants are executing it. In some ways, you could use that as a proxy to say, it's probably likely that consumers as a whole, maybe a fifth of them, don't have any confidence either, right? So how do you bring that confidence to them? How do you show them that, hey, this is a great place to be at, this is a safe place to eat at, and you'll be taken care of? So I think maybe along with that, how do what steps should people be taking to ensure that compliance to safety procedures is occurring within their environments, and maybe even an extension of this is, how do they communicate that to consumers?
Well, the FDA, and I believe that USDA did this before the FDA and the meat plants and food manufacturing, basically moved to a HACCP-based program that included, the next step after that was a food safety management system. And so, like, when you think about the food manufacturers, both USDA and FDA regulated food manufacturing plants for human foods, they have a new program that's under the FSMA rules that requires the organization identify the hazards, identify what controls are there, how do they monitor the controls to ensure they're actually working on a regular basis when they're producing the food, and when they're not found, when the controls are found out of work not working, they have a process to correct those actions really quickly and make sure the food that's going out from the organization is safe. Well, we have the same need for food manufacturing in a restaurant or food service environment. It's not a manufacturing facility, right? So it's not a line that's going to produce millions of products of the same product on a line. It's going to be making lots of different menu items all in one kitchen or one room with lots of different people with different training levels that are making the food. So we need the same process that we use now in food manufacturing and food processing in restaurants. That's actually been done for us. The FDA has described this many times over the years as process HACCP that helps you achieve active measurable control of food safety in a restaurant environment. And the core of that is a food safety management system or systems. A food safety management system is defined as having SOPs defined and people trained on how to perform those things. That includes the recipe of how you prepare and make the food. Where do you source the food from? Is it a safe source, et cetera, et cetera. A process to monitor that on every food prep, right? That's every day, not once a month when we do a third-party audit. It's every day. And then as that process is being managed by a food safety manager, which we call a certified food protection manager, that's like the ServSafe program or other types of programs that certify that person who's a manager to manage food safety, they're also equipped to be able to do corrective action. So they come in, they see Hal working on the front line, he's handling raw chicken, he kind of wipes his hands off his shirt and walks over and starts boxing nuggets or something, right? Forgive me if I use where I used to work and always talk about chicken, but the idea is he sees that because he knows that's not right. He's a manager and he's managing the process of safe handling raw versus ready-to-eat food. He walks over and says, Hal, you have to throw that box of nugget away. You need to go wash your hands, and don't ever go change tasks like that without a hand wash and gloves on. If you don't actually have someone trained to manage that and a system to monitor it, the systems with technology allow you to kind of remind you to go check those things to see if that system's in place. You can't look at every transaction, right? You can't look at every process that's going on. But if you set up a surveillance system using the technology, and the mobile systems are really the best because they help you remind the manager, here's what we need to go check during food prep, during this shift. Here's what we really want to look at. The top hazards are here. Are the beans being held at the right temperature? Well, no, then we're going to have a toxin grow on these beans. So it's not checklists that we do that we check off and get done. It's actually monitoring and measuring and correcting through a manager. That's the best way to make sure compliance is there.
Absolutely, and I think we saw this. Actually looked at this yesterday in preparation. I was looking at the activity levels that our customers were having in terms of these changes, right? And one of the interesting points that we noticed was that so when you look at the data points of activity that folks are having within a restaurant based on what we're seeing today compared to 6 months ago, we've seen nearly a 20% increase on the amount of sort of checkpoints and data points that folks are going through on a regular basis. The kind of the synopsis that we've seen kind of talking to customers is, well, we're not, we're trying to figure out the best way to measure some of these things, and the best way that we figure out how to measure is lots of quick checkpoints along the way and managing and monitoring this process. And then as time moves on and we build a habit of it, right? Because all of a sudden you're asking people to do things that they haven't been doing on a regular basis, building a habit of it, you may then pare that back down 3 or 4 or 5 months later, right? And I think that's.
In fact, I was going to say, CDC actually lists 32 contributing factors that lead to the top 5 risk factors that then lead to all the major foodborne disease outbreaks and illnesses in all the restaurants and food service. But if you are smart about this and you set up your surveillance on your daily assessment to monitor some of those contributing factors, you're not going to have a checklist to check every temperature and every product that you have everywhere in the restaurant. You're going to be based on hazard, where the biggest hazards are that are going to lead to these that are based on contributing factors, and you monitor that. And because your food safety manager is trained and has certification to train, as he or she continues to do those assessments on a daily basis, they're actually getting the flywheel effect of retraining, right? They might forget that we cook temperature 165 for chicken, or actually meats are a lower temperature, 155, right? How do you keep up with all these rules and regulations that we know make the food safe? You got to have technology to help inform, update, and ensure that's being done. But they also have to have a tool to monitor and show that it's been done. And it can be a huge impact on the business, because then the business is actually managing the business of the business is to grow sales, right? Make a customer experience that the customer can actually experience clean. We all hear that when we walk in a restaurant and the floors are dirty and there's food on the floor, the tables are sticky and the bathroom's messy. Do we feel like that's a wholesome environment to feed our children, or for us to sit down and pay $20 for a meal? No, that's why the customer doesn't come back. If you want to grow your sales, they need to experience safe. And that started before COVID-19 with just experiencing cleaning and sanitation in my environment. But now it's actually, is the employee safe? Are they well? Are these places safe for me to sit? So we really need to take advantage of this opportunity. And I don't mean the opportunity that this has happened and we're happy about it. We shouldn't be happy about what was existing before this, when we had thousands of people dying from foodborne illnesses. And for that would seem to be a background noise to our business. But now we're going to take these effects and impact on COVID-19. Well, we need to back up and go back and make sure there's no foodborne illnesses coming out of these restaurants and food service businesses by applying these same principles we're doing for COVID-19 now as we reopen these dining room environments. And let me just say this: if you look at this graph, this information about the semi-confident, confident, and very confident, I'm proud of those who are very confident, but I can tell you could get 100% confident when you have these food safety management systems in your business and they're being updated and managed based on your menu and your customers' experience when you see the sales grow. And you will have a lot of confidence then, not just in food safety, but also the COVID-19 control.
Yeah, and I think maybe this is a sort of diving into this. I don't know if you've seen this in terms of the engagements that you had from different brands out there, but are you finding that the folks that had relatively rigorous food safety practices to begin with are able to shift to addressing, like the coronavirus pandemic and the necessities to change the compliance there? Like, is there a correlation that you're kind of
Absolutely. Absolutely. The clients, we work with all the largest clients. I won't name them, But the ones that call and say, oh my gosh, we need this, what do we do? They're the ones that won't be confident because they didn't have the systems in place already to manage the foodborne illness risk. The ones that call and say, what do you think about this? And you say, oh, that's a great idea. I think that might actually augment your system. For example, yeah, it might be good to actually have a way to kind of clean the air and rotate the air cycle like CDC says, and maybe even disinfect surfaces through these automated systems, whatever. They're already moving to those additional practices to make the restaurant even more tight on safety. But they already had a wellness check in place. They were already doing wellness checks on employees for diarrhea, vomiting, things like that. And they even had sick logs and excluding employees and systems to track, ensuring whoever came back to work wasn't sick. You know, they have these processes in place, and they don't stop doing third-party audits. And they also recommend and respect the health department inspections, which are really important. Those are our public tools for public health to ensure restaurants are in compliance, just like FDA audits food manufacturing plants or USDA audits food prep plants for meats and stuff. But really it's a responsibility of the retail establishment to ensure safety by doing this on a daily basis. So those that were already doing this are just sliding in a respiratory virus with many of the same mitigation processes, except this one area, which is now we're working with something that's in the air, not just on surfaces that can cause cross-contamination of food.
Yep. So this brings us to kind of the next step and the next poll question that we want to ask the audience here. In terms of on average, how long does it take you to roll out a new procedure across your operation? I think relative to the food safety initiatives or the pandemic initiatives, I think this would be an interesting kind of take from the audience. Give you guys a second here to select one.
Mm-hmm.
I think also along the way, as you guys are listening to this, feel free to submit questions whenever you'd like. We're gonna we'll queue some of those up for the Q&A at the end, and it'll be good. So feel free along the way to put that together. So this is an interesting one, right? You've got over 50%, right? Almost 60% of responses are saying about a month or more than a month. 60%, or 57% to be exact here, right? I think there's about a day, 13% is amazing, right? And obviously a week is also quite solid, but I think this 57% mark or the 60% mark is part of what we're challenged with here, right? These pandemics and these changes happen relatively quickly, and it affects obviously consumer behavior, and it affects your ability to communicate that back to the consumers as well. And I think it kind of brings about a natural next question for us, Hal, which is how do we remain agile? Updating these processes based on what's evolving, relative to federal, state, local regulations, and especially given the mix and hybrid models of dine-in delivery. I think I remember seeing Buffalo Wild Wings at the start of this pandemic went, well, instead of just having our big sit-down environments or dine-in environments, we're going to open up these 1,500 square foot delivery only environments. And I mean, as you're talking to some of these brands out there, what's top of mind in terms of trying to remain agile in this environment?
So let me give you an example of where this was important before COVID-19 and why it was important to have a process that's agile to update SOPs for, let's say, a recipe or new use of an ingredient. According to a process hazard plan and a food safety management system, let's say I'm using cookie dough to make fresh cookies in my restaurant. And someone in corporate says, you know what, we ought to use that cookie dough and make milkshakes. And they go, that's a great idea. We already sourced the cookie dough. It's already coming in the back of the house. We get this price. We'll just actually make more money by also making a second product. We'll put it in the milkshakes. But if they didn't do a process HACCP of every menu change, that cookie dough is most likely not made from flour that's heat cooked. And so it probably could have E. coli 0157. Actually has killed people, cookie dough, from this bacteria. So they go ahead and decide, let's go ahead and do that. Seems to be fine. That's no risk. I mean, we're cooking the cookies over here, but we're just going to take that cookie dough and put it in as a ready-to-eat food now. Well, guess what? They can actually have someone die from E. coli from a milkshake, right? Because really the process HACCP plan, if they reevaluate and are required to reevaluate any change in the menu, which means a change in a new item, new food item, milkshake, cookie dough, it would have told them that this cookie dough is not heat treated. We need to source cookie dough with flour that's heat treated so we can remove this hazard. Now we can easily make a ready-to-eat cookie dough, milkshake for the chain and do it safely and never have a death. What happens is they make the decision, someone gets sick or someone dies, and they go, oh my gosh, this is the root cause. We should have done this. Well, you know, you don't have to wait till those things happen. You basically, when you're agile and you have a system like technology can give you, you can say, before we do that, let's recheck to make sure there's any hazards with the use of this ingredient. It drives you to think about how that hazard might change if you're going to change the use of ingredient. Ingredient's still the same, but now I need to source an ingredient that changes the difference, so it reduces that hazard at the supply level, right? So making this less complicated, when you have the same kind of situation going on with COVID-19 guidance from the CDC and FDA, and it changes based on what we learn from the science and the medical science of what virus is doing, right? And when we find out that people with symptoms actually, when they can still shed the virus after they've had the symptoms go away for this amount of time, well, if you're not able to update your SOPs for when an employee can return to work, for example, based on when the symptoms are gone, you're not going to have the whole or all your locations following the same procedure. And now you got a gap, just like the cookie dough, right? You've got to have the ability to agilely update SOPs. Now, food safety, normally we know most of the hazards don't change that significantly in the food safety. We know that some new hazards pop up, like cryptosporidia and romaine lettuce and things like that we always have to be monitoring as new hazards to control in our environment. But most of that doesn't change that often. Well, the agility is the change in how you use the ingredients or where you source the ingredients, or if the ingredients might be unsafe, like recalls and withdrawals. So right now in COVID-19, if you're going to start applying these new principles to contain this respiratory disease, you might as well go back and just start in the right way with menu process hazards, so that you can always protect the menu based on how you use these ingredients and things like that.
Yeah, and this is a good point. Kind of what I was touching on earlier in terms of the activity levels that we've seen, that 20% increase. We've had this with dozens of customers at this point, to where we'll get engaged and they'll reach out to us and say, look, it's Tuesday, something came out this morning that requires me to change something, and I need it live in all of my stores, all my restaurants by tomorrow morning, right? And you're talking 400, 500, 600 restaurants at any point in time, and they're able to define that, communicate that out, make sure that it's being done, track the success of it over the course of the 7 days, or the next 7 days or 8 days, whatever is necessary, and then make those updates along the way, right? And so that agility remains top notch, right? I mean, the things that we're learning on a regular basis just changes the business for us, right? It changes the way that we have to operate internally to make sure that that we can deliver that sort of top line experience for consumers.
And I think, Vlad, in this new environment, with the way we want to, probably a lot of these food service businesses are changing their menu. They're trying to reduce the complexity, the cost, the labor, all this stuff, as we try to, and we want the business to come back, right? We want the food service industry to grow and come back like it was, and even greater. But we want it to come back and grow more safely. We don't want to see 3,000 deaths. We actually want to see 0. And so as they come back online and are doing this for the business purpose of better menus, quicker, easy service, better ways to kind of ensure they can make money based on the profit margins and all that as it relates to how they make the product, go ahead and implement these types of systems that are agile to ensure your menu is always being tracked for the hazards. And that will also ensure that you get ready to improve your ability, and you won't have the worries so much about confidence. You can be 100% confident that with these type of systems in place, you can change the menu or adapt to it based on what your sales are showing you, and very quickly kind of motivate and change that training and the recipes into those environments across the board and every location. So now is the time to do that.
Yep. So here's the big question, and I think this is one that everyone's still trying to get it to answer. But in your view, how much, or how has this pandemic, and also maybe how much as well, is going to change the restaurant industry? I mean, what are you seeing out there with clients that you're talking to, and in general from leaders in the space?
Oh, that's a big question. We all know, from what we're seeing and experiencing, we weren't going into restaurants. We weren't going into any closed spaces where we perceived the threat of being exposed to people that might seem healthy, right? Asymptomatic spread, or they might have had the disease and they're recovering from it, but they're out already, they're feeling great, they're still shedding virus. There's so many different variables that happen on how this virus can be shed. No matter what you hear from the experts and non-experts, the virus can be spread from person to person without them showing signs and symptoms. That's not novel. norovirus can be spread and shed into an environment where the person has no signs or symptoms. They're basically, two weeks before or a week after, things like that. So we always have to have systems in place to mitigate that risk. What are those things? So what's really changed from the pandemic side is, well, we know that can happen. We don't know who has it until we could test everybody and screen them. We have to have some personal hygiene processes and virus mitigation processes in place. Well, COVID-19 has pushed us to think about what those hazards are and how to control them with personal hygiene and virus mitigation processes. So number one, employees washing their hands on a proper, regular basis at the right time, always, right? They're using sanitizer when they can't, especially for the respiratory virus. They can't use sanitizer to replace hand washing for foodborne illness protections, right? But they can use it for protecting their hands from COVID-19. But that's a new thing that's got to be monitored and trained. Who's doing what, right? When? I think glove use is important, especially for protecting the food, might be also in protecting the employee from touching their face and things like that. Kind of gives them a barrier not to touch things. Wellness screening is also going to be, it's being done and mandated everywhere now. Before it was being done on a voluntary basis just for foodborne illnesses. That's changed significantly, should stay in place and stay sticky with foodborne illnesses too. That's changed. I think the virus mitigation process, like I mentioned before cleaning and sanitation was kind of like, we don't really need to clean and sanitize anything. It looks clean to me. But well, now we've got these hidden pathogens we're now much more aware of. We knew they were there. We weren't thinking about the outcomes of people actually getting sick until you have an outbreak. But you don't have to have an outbreak to be causing a lot of foodborne illness. You can have a lot of sporadic cases of foodborne illness and you're causing them, but you don't really have a process ensuring that you're managing sanitation and also now disinfection for those surfaces. So in the longer term, as we go forward, what I think is actually could be good for the industry is opening up these doors with both in place. One day the respiratory virus threats are going to go away, and hopefully soon, then later, and we won't feel so worried about going into a crowded area and those type of things, so we can open up business. And again, I might be going against Anthony on some of this stuff, but I want to hug people and shake their hands. We're people. We have to have people contact. And so one day we hope that goes away, but guess what? There's still a threat out there. We were all preparing for pandemic flu, which is an avian influenza, which is spread from person to person and actually would have caused a lot more serious illness and death and shut down a lot more than just what we've done already. So we have to still understand that there are still respiratory virus risk out there as well. But if we have these systems in place now that we put in personal hygiene systems, wellness checks, glove use, proper glove use, hand washing, virus mitigation for proper cleaning and sanitation, and a food safety management system that ensures you're doing it, that you're in compliance, you're actually doing it, and you can prove it, guess what? We're going to be prepared for that one too. And so I think that's what's going to really change and has changed our industry. I'm not saying it's good. I'm not saying it's going to be for the better. I think it should have been done before the pandemic, but now let's just go back, open up doing that as the right way to do business.
Yep. No, that's very relatively sort of thoughtful insight for the future. So let me take a pause there. We got about 15 minutes left here, and I want to make sure that we get into some Q&A. We've got a couple questions here, Hal, starting off here. I guess the first one is there a measurable level of there we go, sorry, it popped up for a second. Is there a measurable level of how to pronounce this, quaternary ammonia that is effective for disinfection of high-touch surfaces? Is there a test strip that measures at that high of a level?
That's a really good question. The quaternary ammonias are a group of chemicals, right? It's not just one. They have different types of molecules that are used to make these type of products. So number one, the key part is what is that chemical in the quaternary ammonia product, or what we call quats, because they can be very different, right? Some don't kill the virus at all. So you can't just say a quat will kill it because it's a quat. Some can and do. They might take a little longer than an alcohol-based type of disinfectant or other types of disinfectants that the EPA registers. So really the critical part here is for us to have trust in what the chemical is and who makes it, and it's safe to actually use to kill the virus. Either CDC will come out and say, we know 60% alcohol will kill the virus. So if you don't have anything else, 60% alcohol will do it. FDA and the EPA and CDC work together to help us understand what products, based on their label and how they're sold, can tell us that. And so the EPA disinfection list, and there's also an emerging diseases list too, is really the best place to start to check that. Is my product, no matter what it is, on that list that the EPA and scientists have actually checked and confirmed it does kill this virus? That's really where we can't take risk of guessing like this. There are test strips to kind of measure the concentration of clots, but they're based on pH, so they're not really good to actually say this is going to be effective because it's this concentration. They're basically just looking at the pH of the product. We just don't have the technology to tell us that yet, so we really have to rely on what's the label, the EPA guidance that tells us it's safe. Number one, also safe for humans to use, right? You don't want to have something out there that kills humans when we're using it. So PPE is important on how you use these disinfectants, but it just needs to make sure that it does have efficacy according to the EPA and FDA standards.
Yep, that's good. Next question we've got, do gloves just give the appearance of added safety measure? If the virus is on the glove, no different than if on the person's hand, unless gloves are being constantly changed.
I think a food safety management system is critical to ensure proper glove use, because you're exactly right. Gloves actually have been shown to contribute to not as much as bare hands, but almost as much in foodborne disease outbreaks, according to a lot of research published by the CDC and FDA, and many of the scientists have published these things and monitor them in different states. And so, yeah, a glove could be used to actually go and handle raw chicken, and then just wipe the gloves on my uniform and go over there and make ready-to-eat food. No one would know, right? I'm not changing my gloves. Gloves can actually have pinpricks and things that leak in our sweat and things on our hands anyway. So if you don't have a process to manage the proper glove use, and again, you don't have to do every single glove interaction or every single glove change, but you need to be checking. If you're not even checking to see if they're wearing gloves at the proper time through a daily assessment process like this, how do you know? You certainly can't trust. And so gloves do form a good personal hygiene barrier, again, because we know even if an employee goes to the bathroom, has norovirus, has diarrhea, continues to work, doesn't tell anybody, and maybe doesn't wash his hands, or maybe he washes his hands really good, but guess what? He forgets that when he's washing his hands, he touches the sink handle, and the other, he's contaminating that sink handle, and another employee comes behind and touches that sink handle. Now he's got the virus on his hands. So, but gloves can be a very important and effective barrier between hands and what we've touched, even when we've washed our hands, when we handle ready-to-eat food. When you're thinking about COVID-19, gloves could be a higher risk if they're not used properly, because like you said, it could be viruses, he's touching surfaces thinking he's protecting himself, and then they're actually spreading the virus to other surfaces that other employees can touch and then touch their eyes and mouth and things like that. So yeah, glove use is very critical. And again, I hate to sound like a broken record, constantly saying food safety management systems and technology, but how do you know unless you have a management tool in place to manage it?
Yeah, that's a good point. There's maybe alongside with this, we're discussing hands and gloves, maybe in terms of people's faces as well. Are face shields alone an effective means of facial protection, or do they also need to be accompanied by face masks?
Yeah, it depends on the situation. A lot of folks in working with sick people with a high degree of viral shed, which means they had a lot of coughing, sneezing, they've been identified and tested positive, they're in the hospital trying to recover. Face masks can be an additional barrier to reduce those droplets when they sneeze or they're coughing, and it's a lot of virus coming. So it could definitely suppress some of the viral load coming to the face, but they're not going to do it without a mask. And so face masks alone are not going to be effective if someone actually has viral spread. We don't know how much virus is being spread, when they're asymptomatic. They're doing research on that now, but that's a long-term study to find out how much is it based on different types of signs and symptoms and fever and all that. It's going to take years to understand that. So we just don't take the risk. We say, look, the best way to prevent this, if you're non-healthcare, you're not working with people are sick, is to wear these cloth masks covering. And if we're wearing one and you're wearing one, we're going to reduce the amount of virus going back and forth between us pretty significantly. If the person's really sick and coughing, maybe not, right? They need to be staying home. They can't just put a mask on and suddenly everybody's fine. A mask is there to get kind of to protect the what if, and it does suppress some of the virus going between people. We just don't know how much and how effective. And again, because it's a national emergency, we needed to put some mitigation effort in place. And this is a good personal hygiene tool we know does work, but it's not going to protect you, alone if you were, healthcare workers aren't in a hospital in an ICU working with cloth masks. They're working with N95s that will block, they're fitted to block all viruses and bacteria into their respiratory tract. They might wear a face mask to reduce the amount of stuff coming into that environment when near their face. Because again, you might have a mask on, but then someone coughs and sneezes and it gets in your eye, right? And so, but I don't think you're going to see that at that level of virus mitigation going out there in asymptomatic people that aren't staying home. But if a face mask helps, in some situations, because you might think there's a risk, for example, food manufacturing or other places where it might be close contact with a person and you just can't take that chance and you want to reduce that spread of other things popping into their eyes, then face masks or other PPE can be helpful for that too.
Got it. Yeah, no, that's it's a lot of moving pieces and decision-wise. We got one more here, right? I think as in terms of some of the questions that keep coming up regarding people trying to get wrap their arms around what they need to get solved here. Maybe a question for this one seems to be a little more directed to you, but in what way do you typically work with to clients to make sure that they have got the right processes in place? What's the way that you typically engage with some of these folks?
Well, my personal recommendation would be to benchmark against the standard. The FDA food code is almost 800 pages long with appendix that basically are all built around the proper controls to prevent foodborne disease illnesses. The CDC gives us the guidance, I think, as the kind of source of truth for mitigation of other public health threats like pandemic coronavirus, things like that. So the standards really are there. Then how do I adopt those standards or translate them into operational SOPs and things like that? A lot of that guidance is in a lot of those in the FDA food code and things like that. But then as we get trained in different types of training programs to help us learn how to manage certain things, you just base the recipe on what those systems are that are going to be based on that standard to prevent, whatever illness you're trying to prevent. So to answer the question, the standard for food service is process HACCP and active management control. It's well-defined, tested, proven to work, it prevents foodborne disease illnesses. If you have health inspections data, let's say a score or a grade, that shows that you have a critical violation, which are also the same, they're called foodborne illness risk factors. If you have those in any of your stores, you are likely contributing to foodborne illnesses, or you're going to have an outbreak. Because if you don't control those foodborne illness risk factors, which the health department will call critical violations, we know that those are direct one-to-one, missteps that actually can cause food to get contaminated and people to get sick. And so, if you make your standard process HACCP where you take your menu, you look at your menu's hazards, the ingredients, where they're put together, if they're cooked, cooled, chilled, how they're served, where you get your source of ingredient, and you base all that on the standard of what the hazards are and how to control them. And most of the controls are well known, for heating food at the right temperature, holding food at the right temperature, cooling it down at the right time and temperature, making sure employees aren't handling food with bare hands, all the things we know are good controls, but you have to benchmark that against those standards and then put the system in place to monitor and measure it after you've trained everybody on how to do it, right? I know it sounds like a whole lot and it can be overwhelming, but it's really not. It just starts with the simple part of making sure you know your menu, the hazards in your menu, benchmark the controls that will mitigate those hazards, and then monitor and make sure they're being done every time you're preparing food. And again, it's backed by the best science in the world from the FDA and the CDC and the USDA. And the scientists in academia that are all the major top universities around the country who study food science and food safety, they're constantly looking at, is this a new hazard? What's going to happen if this gets in the food? How do we mitigate the hazard? They're always working on that, to ensure we can get the right controls. And you don't really have to do much of that yourself at all. It's just aligned to that standard, and then you can be confident that you're actually preventing these diseases, especially now respiratory diseases, right?
Yep, and it sounds like from what you've been kind of repeating is that all this for anyone who has any sort of scale in terms of number of restaurants, number of locations they're managing, the technology plays a central point in that, right? To be able to kind of streamline it and pull together. Is it even feasible to do without technology in this day and age?
I'm a strong advocate, and it just so happens, a fan of input because again, trying to do things on paper checklists, no offense to people that use tablets, that's great if it works for you, but being able to kind of easily communicate through our most standard communication tool, which is a smartphone that can adapt to everything we need to have them do, but not have them have to always stop and go through a 30-minute assessment and do this. It needs to be integrated into the business model of preparing food. It can be built around exception. So you know what, everything's running smoothly and I don't have to do much except do some surveillance and check the systems are in place. But I do want to hear about exceptions. So let's say I've got 3 restaurants, doing this menu item, and I find out from the data that I'm looking at that all 3 are having trouble with this one control. It may not be the control at the restaurant. It could be that the control was lost at the food manufacturing, where, for example, they might be finding that the food is too thick and it won't actually thaw and cook properly, and they're trying to cook it longer, which is not going to give it good quality in the restaurant, but it really was the control and responsibility of the supplier to give them the right size meat that actually will fit the model of thawing and cooking they're using in the restaurant, right? So it's not rocket science, but if you don't have that as a process of vetting the supplier, making sure you're monitoring the right specs for the food, making sure the restaurants can actually do that, they don't have to stop doing what they're doing, which is growing sales by making great food and doing great service.
Yep. Hal, along the way, can you clarify, by the way, what is the best disinfectant for wiping down dining room man tables?
Well, there's several different types. There's not one specific, but the disinfectant has to be rated according to what the EPA standards are, or like standards. Like there are some products that haven't been tested for COVID-19, but they have been tested for SARS, right? SARS virus or MERS virus, which are the same type of virus, just a different type of moiety of the virus. But EPA will allow that product to be produced and actually state on the label that it will kill pandemic or COVID-19 coronavirus. So if you're looking at specifically what you would have to have if you can't find that, like the EPA disinfectants, and the CDC has guidance on the proper use of chlorine. Clorox and things that we buy off the shelf for laundry service is a high pH, and it's not going to be as effective as just chlorine, but they do give guidance on that. If you don't have any other ways of getting a disinfectant, they give you the standard for how to dilute Clorox or Clorox type products to use against. And they do that again for norovirus too, as a backup or backdrop for if you can't get those disinfectants. But I highly recommend that because you don't want error and mixing and diluting, and especially across a chain or large multi-locations, you don't want people to take shortcuts or take errors, or they're out of product and they kind of dilute it less or whatever, or over dilute it, right? Chlorine can be dangerous in high concentration in the air for employees. And so, I just recommend going with the EPA disinfectant list and buying and using those products. I think they should all be available at some point, if not all of them right now, but many of them are. I'm a big fan of wipes. People have always told me, wipes could be expensive, but they're really not. When you think about, I don't want to wipe something off with a reusable towel and then reuse that again to wipe another surface. In some circumstances, we know reusable towels needed. You can't deep clean a chicken, or food prep area that's got a lot of grease and oil with wipes, and you'd run out. But it's definitely needed. But when you have critical parts of preventing transmission of, say, of a virus like norovirus, or critical transmissions of preventing other things, you really want to get a highly effective tool that kills the virus, like a product that kills it very quickly on the surface. And then wipes can be used that have these same disinfectants in them, that then you just wipe the surface, it stays wet and disinfects, and then you just throw the wipe away. So you're not really spreading the germs, you're just throwing the germs away. So I'm a big advocate in some circumstances where I think the wipes can have a big value, because the employee's going to use it right? They're just going to wipe the surface, it's going to stay wet for the contact time it needs, and then you throw the wipe in the garbage can, so you're not spreading it.
Yep. Maybe the last question here. Do you recommend COVID testing for all returning staff as a best practice for opening restaurant?
It's I get that question all the time, and the way I answer it is because I'm a public health expert, but I'm not a medical doctor. And these are personal type, medical type situations that have such a high degree of variability. For example, I was just reading today in several magazines, JAMA and some others, that that published medical results, that there's a lot of people that are testing negative or testing positive, even with the serology test. So we at one time we had, I think, 6 serology tests out there that could check your blood when you didn't have symptoms, that to see if you might have been exposed or had the disease, infection at some point. Several of them have been taken off the market because they have lower than expected specificity and sensitivity, meaning they can't really identify a true infection. There's a lot of variability in serology tests anyway. I used to work on them and try to develop them for mycobacterial diseases, and they're just very difficult because of the age and the person's prior history of exposure, et cetera, et cetera. But I think, so it's really hard to say, but that's going to really help you. For example, we had a fella here test positive with COVID-19 who lives underneath me and the condos. He's high risk, he's over 80, he just had a heart procedure in January. He shouldn't be with us today, but he tested positive by the nasal swab. So it meant that the PCR showed he had virus in his sinuses. He never got any signs and symptoms. That doesn't mean it's a false positive, but it does call into suspect, why was he carrying virus? He didn't get infected and get disease, right? So there's just so many variables that force you to try to interpret those results, that to me, if you're going to do anything, make sure the personal hygiene and virus mitigation programs are in place and you're checking the compliance for those to ensure that is your #1 tool to try to reduce transmission of both foodborne illnesses and COVID-19. And then as you start to move to questions like, should I check their temperature? You got to ask yourself, what am I going to do with that result? If it's negative, does that mean he doesn't have COVID-19 and now we're good to go, no mask? No, the variable is still there. I mean, it could be negative fever and he could still be shedding the virus asymptomatically. So the critical component is those personal hygiene and virus mitigation tools we've talked about, and making sure they're in compliance to them, not the checking the temperature. Not that you shouldn't and can't, and some health departments require it, but it's not going to be 100% protective because there's just going to be too many variables. So really just focusing on the controls, right? If you hear anything else from this presentation, just make sure you got the controls in place for all these other variables.
Yep. Well, let me finish off with a couple of just points on here. Just want to share a couple of things for additional resources for Hal. You get obviously activeFoodSafety.com is one of your main kind of focuses today. You've got your publichealthinnovations.com, the consulting practice, and also you've got a book coming out August 2020. So we've got another two and a half months until it's out, maybe a month and a half. So this is around food safety management systems and achieving active manager control of foodborne illness risk factors in a retail food service business. So for those that are interested, August 2020 is at Amazon or any other place we can go find it.
Yeah, Amazon and Springer. Again, it's part of the food microbiology series from the IFAP, but it's with 2 years of research, including research of what FDA recommends for food safety management systems. It really is the how-to, and it's very short, but it helps you also with the value proposition for your organization to show them, if you do these things, what it's going to mean to your customer experience and sales too, not just your safety.
Yep. And then on our side, we've got a program that we run today. It's our COVID-19 program that's extended through August 2020, and we basically help operators, both food service and food retail, enable their COVID-19 action plans together. So if that's something you're interested in, feel free to go to zenput.com/COVID-19 or just send us an email at COVID-19support@zenput.com. I think that brings us right to the top of the hour here. So really appreciate, Hal. Thank you once more for joining. It was a pleasure as always to spend some time with you and do this in front of a live audience. And thank you for everyone for joining in, taking time wherever you may be in the world, and asking good questions and participating. Hopefully you guys have a great rest of the day and enjoy your upcoming weekends here. Hal, once again, thank you so much for joining us today.
Thank you, my pleasure, and let's all get back to business and let's make it even more safe.
Agreed. All right, everyone.